Good evening and welcome to our COVID-19 update. I am Ladi Akeredoluale. Here are the highlights at this hour. 3 state governments signed significantly reduced budgets for 2020 owing to COVID-19. Bauchi State authorities approve reopening of schools to exit class students from August 4. Let's begin from the states that have revised their state budgets. The governors of Gombe, Bayelsa, and Cross River State have revised their individual state budgets downwards. This follows the impact of the COVID-19 pandemic on their various economies, which has led to a drop in monthly revenue.
Cross River State becomes one of the 2 new states added to national testing capacity, just as the agency, NCDC, is leading the expansion of testing capacity for COVID-19 in Nigeria. Very early in the year, the Cross River State Governor, Ben Ayade, signed a budget known as Budget of Olympic Meritamices. Interesting as that sounds, it was geared towards forestalling any possible hardship and effect of COVID-19 pandemic on its citizens. In addition to the budget provisions, the state government has formulated tax relief and palliative for businesses and individuals operating in the state.
Tourism Development Levy, the 100% abatements from February to November 2020. This means that Tourism Development Levy, all operators, hotels, guest houses, etc., will not be required to pay Tourism Development Levy.
That this should not end there.
In Bayelsa State, also in the South-South region, the situation is not different. The governor, Dore Diri, while speaking at a forum to review the 2020 budget in Yanagwa, explains that the projections of the initial budget had to be re-evaluated to reflect the current realities of the global economic meltdown. He, however, assured civil servants that their salaries will remain.
Now, after the revision, our total annual budget for 2020 now stands at 183, that's 183 billion, 155 million, 572,401 naira.
Governor Yahaya has also revised the 2020 budget from 138 billion naira to 107 billion naira. The reversed budget passed by the State Assembly is signed into law by the state governor, who explained that the reduction of the budget size was owing to the prevailing economic challenges and the COVID-19 pandemic, while the health sector remains the beneficiary with the inclusion of modern health facilities, including testings for COVID-19 virus.
The earlier budget, Appropriation Act, statutory allocation was 42 billion. Now it has been revised down to 29 billion. It's a variance of 13 billion. Value added tax was 15 billion. Now it has been revised to 11.5 billion. That's creating a variance of 3.5 billion. And then internally generated revenue was 11.265 billion. Now it has been adjusted to 9.9 billion. It's a variance of 1.347 billion.
The COVID-19 pandemic, no doubt, have seen reviews across every strata, government, agencies, and regions. What may be soothing, however, is how agencies and authorities make adjustments that cushions the possible adverse effect on the citizenry.
Moving on to Ekiti State, where doctors in the employment of the state government have been making certain demands for their welfare as a strike action enters another week. The doctors, supported by the Nigerian Medical Association leadership in the state, leased unpaid COVID-19 and hazard allowances, unpaid rural posted allowances, delayed promotions as some of the issues in contention. However, the state's Commissioner for Health faults the timing of the action.
While the governor of Ekiti...
It is on record that it is only doctors and health workers in the employment of Ekiti State Hospital Management Board that have never received a dime as hazard allowance for over 10 years, despite same being paid to other health workers in the employment of the same state government and other health facilities across the country. It is thus not surprising that while other states, including our neighbors, have adopted the Memorandum of Understanding the federal government had with health workers on the payment of COVID-19 hazard allowance and inducement allowance, which had since been paid by federal health workers and circularized by many states, it is still a mirage here in Ekiti State. It is also pertinent to note that a doctor working at the primary and secondary level of care in Ekiti State is currently at least 2 or 3 grade level below his colleagues and counterparts who are employed in the same day, in the same Ekiti State, but choose to work in the institution of HMB because of the failure to implement promotion as at when due.
The skipping is the major issue, and from what I understand, it came on board 2014, and they were requesting, from the way I understand it, is jumping levels, the grade levels where you are being paid. Nobody is disagreeing that paying people what they think they should be paid is wrong. The only thing we are discussing is that it's not the best time. This time that COVID-19 is going on, the states are struggling to give PPE, to pay for all the things they have to pay for. The money is not just there.
Staying in Ekiti State, where some of the close aides of Governor Kayode Fayemi are said to have tested positive for COVID-19, the State Task Force on the disease says disclosure of status remains the exclusive right of infected persons. The task force also advises residents against hiding after testing positive for the virus. Let's get the details from Babajide Agbeyo.
While the governor of Ekiti State, Dr. Kayode Fayemi, has gone on isolation for COVID-19 treatment, the State Attorney General, Mr. Wale Fapunda, has also announced that he tested positive for the virus. The governor had advised members of his cabinet and his close aides to go for testing to ascertain their status at this time. At the medical front, doctors in the employ of the Ekiti State government have been flogging certain demands for which they have been on strike for over 2 weeks now. These doctors comprise those in the state general hospitals, state specialist hospitals, and primary healthcare facilities, among others. They complain of unpaid COVID-19 allowances, hazard allowances, rural posting allowances, and delayed promotion, among other grievances which they have listed.
It is only doctors and health workers in the employment of Ekiti State Hospital Management Board that have never received a dime as hazard allowance for over 10 years, despite same being paid to other health workers in the employment of the same state government and other health facilities across the country. It is thus not surprising that while other states, including our neighbors, have adopted the Memorandum of Understanding the federal government had with health workers on the payment of COVID-19 hazard allowance and inducement allowance, which had since been paid by federal health workers and circularized by many states, it is still a mirage here in Ekiti State.
Nobody is disagreeing that paying people what they think they should be paid is wrong. The only thing we are discussing is that it's not the best time. This time that COVID-19 is going on, the states are struggling to give PPE, to pay for all the things they have to pay for. The money is not just there.
It is definitely expedient for these key players to, at this time, reach a compromise, as any decimation of hands in the health sector will not be healthy for the system at the moment. Babajide Agbeyo for COVID-19 update.
In Bauchi State, the governor has given approval for public schools to commence preparations to meet the August 4th deadline for resumption of exit classes. The State Commissioner for Education, Dr. Aliyu Tilde, has been speaking about arrangements ahead of that deadline.
In fact, together with the Ministry of Health, we formed a committee and that went into the guidelines that were provided by the Federal Ministry of Education. We itemized the requirements, come up with a cost, and now that we know that it's only the exit classes of SS3, for which we have about 34,000 children that will come and write the exams and go. So we are ready. We have gotten the approval of His Excellency, and we will make sure that we have put most, if not all, the items in the place before the opening, possibly August 4th. But if we cannot beat that deadline, we have a range of a week within which to call them. And I believe all will be ready. No, fortunately, it is only the final class that is reporting back. So they can use the other classrooms. And how many we keep in a classroom will also depend on the requirements of WAEC, because that will require additional invigilators and so on. But I believe that the social distance, by and large, will be observed. Yeah, the time is short. We will have to rush and fumigate as quick as possible and acquire equipment.
Going to the southeast, where Imo State has recorded 8 new cases in the last 24 hours. The last time this was recorded was on Friday with 3 patients. Let's bring you an update from our correspondent there, Eyitokwe Kutei.
The figures of confirmed cases of the coronavirus disease is increasing by the day in Imo State. Some indigents are worried about these growing cases, even though the increase is not peculiar to Imo State. We went round over the Imo State capital earlier today to speak to indigents on their thoughts on these growing cases, while some also took the opportunity to speak on the federal government's directives for exiting students in school to resume.
We are talking about maybe schools like primary schools, kindergartens. You and I know the state of this nation. I don't think things have been put in place properly so that children can go back. I think there still needs to be some level of preparation for school to resume.
Government should extend whatever they are doing to the grassroots, not stopping at the township, the central and urban areas. It's not enough.
The challenge is in the enforcement. The enforcement is not adequate.
Meanwhile, the Imo State government is not relenting in our efforts to combat the deadly coronavirus disease. Just yesterday, the Imo State Governor Opo Zodima met with traditional rulers across the 27 local government areas of Imo State to urge them to continue to support the state government's commitment and fight against the coronavirus disease. He also urged them to step up their sensitization in their wards to contain the spread of the coronavirus. We'll continue to bring you up to speed with events and happenings around here as it concerns the COVID-19 pandemic. From Owerri, the Imo State capital, Eyitokwe Kutei for COVID-19 updates.
In Jigawa State, lawyers lamenting the effects of COVID-19 on court proceedings. According to them, the Nigeria Correctional Service officials are preventing suspects from attending court hearings, which hampers their various cases. However, the public relations officer of the Correctional Service in the state says they take suspects to court as it went due.
Although Jigawa has no active case of COVID-19 in the state, other activities continue to suffer. At the Court 3 in the Federal High Court in Dutse, the state capital, COVID-19 protocols are observed. But the absence of suspects who are remanded at the correctional centers in the state becomes the issue of contention.
For example, I just came out from a criminal case in a court, and the accused persons were not produced from correctional service centers because they said that it's a satellite prison. They said that no prisoner should be allowed to come out to attend his case in court, and no new prisoner should be taken to that. So actually, if a prisoner is not in court, cases will not go on, and delay will continue, and it will be detrimental both to the system, to the accused person, and even us lawyers, because we will not get money, we will not get paid for the services we rendered, because actually we will not be doing anything. So actually, if it comes to criminal cases, COVID-19 affected us negatively as legal practitioners in Jigawa.
However, the public relations officer of the Nigerian Correctional Services, Jigawa State Command, believes otherwise.
We produce inmate to court as when due. Anytime there is production from the court that we should produce so person to court for judgment, as soon as there is a sitting judge in that very court, we produce those inmates to courts. There are lots of protocols that we follow. There are guidelines, rules by the NCDC, which we should be following. We don't receive in the beginning of the COVID because of a circular that we received from our national headquarters in Abuja, telling us, authorizing us not to receive anybody into the correctional facility because of the COVID-19 pandemics. But as time goes on, at the middle of it, we now got another circular that we should produce 2 isolation centers in our state here in Jigawa. We have that of Gumel and that of Hadija. They are all well equipped, and we've started receiving inmates.
While the state continues to fight against the spread of COVID-19, the hope is that important activities do not suffer in the process.
In Nasarawa State and other states, they do continue the battle against the rise in COVID-19 cases. But the governor of Nasarawa State, Abdullahi Sule, has lamented the shortage of medical healthcare workers, a challenge which he hopes the new College of Medical Sciences will solve. At the handing over ceremony of over 160-bed capacity to the Federal University Lafayette for full takeoff, the governor requested that 50% admissions for the study of medicine be reserved for indigents to help fill the gap of inadequate health personnel in the state.
I need to reiterate that government will continue to support the university and all other institutions in the state in the training of medical personnel who will handle the issue of healthcare delivery in Nasarawa State. Distinguished ladies and gentlemen, it is obvious that there is a general shortage, that there is indeed a general shortage of medical personnel and human resources for the healthcare sector in the country, and particularly in Nasarawa State. Hence, the establishment of the medical school by the Federal University, which will serve as a necessary encouragement to our teeming youths to take up the medical vocation.
We'll take a break. When we return, we'll expand the news on COVID-19 and take in some discussions on the numbers. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Teachers and graduating students in Yobe State have commended the federal government for resolving the controversy trailing the school reopening in Nigeria. They say the decision has given hope to the exiting students, especially the trauma of missing the year as a result of the COVID-19 pandemic.
Since the outbreak of COVID-19 in Nigeria over 5 months ago, issues surrounding the reopening of schools have been laced with controversies among parents, students, and stakeholders in the education sector.
Schools under the supervision of the Federal Ministry of Education will not reopen.
One of such pronouncements was on July the 8th, 2020, when the Minister of Education, Adamu, announced that schools under the control of the federal government will not resume for the West African Examination Council, a decision that attracted criticism. 3 weeks later, after a unanimous decision, the federal government announced August the 4th as the resumption date for students in exit classes.
When the news came out yesterday, we were very glad, and it was a very good news. Now, before the 17th of August, according to the news, 17th of August was supposed to be YX. So if we are resuming that forth now, it will give us a good time to glance at our books and get back some of the things we have missed from school.
We have overstayed our holidays at home. So I was so excited when I heard about the news that we are going to resume.
Some teachers who spoke with Channels Television explained how the stay-at-home impacted negatively on both the teachers and the students.
The stay-at-home have affected the teachers
because in the system of private school, no work, no pay. The only source of our income is the school fees.
It's a good step ahead in the right direction. Most of our teachers and students are traumatized because of the lockdown, and I believe that will help most students, most teachers will be happy that the school is opening back.
Although Yobe State government is yet to make its position known on the matter, but necessary safety measures such as hand-washing facilities, face masks, as well as fumigation of the school against reptiles and termites need to be put in place before the resumption date.
829. That's the number of COVID-19 patients discharged in Nigeria within the last 24 hours, the highest daily recovery made so far. The people were discharged in 13 states, with Delta State recording the highest figures of 584. River State discharged 55 people, Oyo 37, Kano 30, Edo 25, Ogun 22, and Lagos 17. Others are Bayelsa and Kaduna State, with 13 patients discharged. The Federal Capital Territory 11, Kwara 9, Imo 8, and Benue 5. If you take a look at the Channels TV monitoring dashboard for COVID-19, you'll see that the total number of recoveries stands at 18,203. There's 648 new infections recorded in 21 states by the NCDC, brings the total number of confirmed COVID-19 cases in the country to 41,180 at the moment, while the total confirmed fatalities is now 860, leaving the number of active cases at 22,117. Taking a look at Plateau State's figures specifically, let's see what the COVID-19 situation is like in one of the states in Nigeria's north-central region. The first case of COVID-19 in Plateau State was recorded on the 23rd of April 2020, but since then the state has gone on to record a total of 982 confirmed cases, with 446 patients discharged and 19 deaths recorded. The state is still managing 517 cases at the moment. Let's talk a little bit about COVID-19 and its effect on one of our very important sectors, talking about the nation's economy, and that's international shipping. And to do that, we're being joined via Skype from the Apapa area of Lagos by Engineer Greg Ogbefon, former president of the Ship Owners Association of Nigeria. Engineer Ogbefon, thank you for your time. Welcome to the program.
Thank you for having me.
International shipping has been very badly affected by COVID-19, but I want us to zero in on its effect in Nigeria. Apart from the lockdown and the fact that many of the activities that would traditionally go on alongside shipping were stopped during this period, can you tell us a bit about what had happened to international shipping from the Nigerian angle at this time?
Well, the international, and if you like, the local shipping has not been spared in the effect of this unfortunate pandemic, COVID-19. But I'd like to talk more about the effect on national shipping, because as you know, we really don't participate too much in the international trade yet because we don't have international fleet. Most of our shipping activities in country are related to the oil and gas activities. So you find most of the ships that we operate in country are either the upstream type of ships working for the oil companies in their exploration and exploitation business, and then the downstream, those who are involved in product trades, either lightning, mother ships, and generally going from our refineries to other depots. Now, in terms of the effect of COVID was most felt or is most felt in the area of human capacity, because as you know, most of the seafarers who serve on these vessels have to spend some time on the ship and then come back to go home. At the time there was a lockdown, Thank God for the likes of the regulatory agencies like NIMASA, who engage the authorities to give a free passage to the seafarers. But the most impactful effect of it is the aspect of having to quarantine people before they go on board a ship. So we have to quarantine the seafarers for about 2 weeks in designated locations, and then they are tested to be sure that they are COVID-free before they can go on board. And those coming up as well have to be quarantined for 2 weeks and ensure that they are okay before they are allowed to go home to meet with their families. So it affected the human aspect of it. In terms of the economy, of course, COVID coincided with the terrible, unusual crash in oil prices to the extent that oil was at the time selling at negative figures. So the effect of this was a massive layoff of ships operating in the oil and gas sector of our economy, because the industry could no longer even sell the oil they produced, and there was a backlog of oilage that they couldn't get rid of. So right now, as we speak, a large percentage of ships that were operating upstream have been laid off, so you have the attendant effect of that, job losses. Companies are unable to meet their obligations to the financing institutions that help them buy the ships and things like that. But we are hoping that as we come out of it, things will begin to come back. But on the positive side, this COVID pandemic has helped ship owners to deepen their application of information technology on the way they do things. Most companies are now having to run their business on virtual platforms, Zoom, Go meetings, and things like that. And it's proving to have some advantage in the sense that you are not having to be on the road all the time. You're not running office overheads, and you can actually have your meetings on Zoom where you have 100% attendance, as against when we're operating from the offices where you cannot guarantee that you'll have 100% attendance. So from that effect, most ship owners are now deepening their information technology and information communications infrastructure for their businesses, which is making it more efficient.
Let me jump in at this point and ask you that, okay, if what you've told us so far has been the effect of its arrival, that is COVID-19, now that, as you point out, we're coming out of it, the government has put in place some measures, it says, are to help various industries to recover because it recognizes that this was a real problem. In the case of shipping, have you felt that? Have you gotten involved in that as part of the process of getting out of the effects of COVID-19 and possibly re-employing some of the people that you laid off when the ships had to be laid off from the service contracts as well?
Well, much as I would have liked to say about that positively, unfortunately, I don't think there has been any concerted or intentional attempts to try and cushion the effect of COVID in our sector. If anything, those of us who are still looking to operate are operating under very stringent conditions, whereby rates are lower, the cost of running your business is higher, and there's really nobody you can cry to, because when you do, we are quickly reminded that government wants to reduce the cost of production of oil, for instance, by 40%, and this is passed down, of course, to the ship owners. So we are hoping that government will know the impact of this, because a lot of people are out of job in our sector right now. Those who are there are struggling, and so before the system completely grinds to a halt. And one aspect I would like to quickly talk about is the fact that government now needs to begin to pay a bit more attention to the sector. All the ships that are operated in Nigerian waters are built outside this country and imported into this country. Okay? I think the government will have to start looking seriously at developing in-country capability for shipbuilding, at least for the type of vessels we need in our cabotage domain, so that we don't have to keep going to China, Europe, and South Africa to build ships that can actually be built here with the attendant job creation, stem of capital flight. I think that is something the government will have to do right now, because every country is beginning to look inwards for their needs and develop in-country capability. And shipping is one very important, I think, government needs to look at.
Indeed, thank you very much, Engineer Greg Ogbefu, former president of the Ship Owners Association of Nigeria. Thank you so much for your perspective on this topic and for your time.
Thank you. It's my pleasure to be in.
Let's go to Plateau State, the subject of our COVID-19 monitoring dashboard a couple of moments ago, where the government is expressing concerns over the high rate of community transmission of COVID-19 in the state, a move which has prompted it to commence mass testing of the residents with directives for more public enlightenment, publicity, and community engagement of the people.
Plateau State, north-central Nigeria, has a population of around 3.5 million people. The recent increase in rate of community transmission of coronavirus is of high concern to the state government. To this end, the Secretary to the Government of Plateau State, Professor Danladi Atu, explains the efforts of the government in managing the pandemic. He states that 982 people have tested positive, with a total cumulative sample of 14,816, out of which 10,922 results have been received. Testing facilities in the state have been increased to 3, with testing centers at the National Veterinary Research Institute VOM in Plateau State Specialist Hospital and the Jos University Teaching Hospital.
As of today, July 28, 2020, we have tested a total of cumulative samples numbering 14,816, out of which 10,922 results have been received. The pending results are 3,894. From all the tests we conducted, 982 have tested positive so far.
Also speaking on the forthcoming Eid al-Kabir celebrations, Professor Atu says that meetings have been held with Muslim Umar and security chiefs in the state, and the state task force has put measures in place for a hitch-free celebration with strict adherence to COVID-19 protocols.
Prayers at Eid grounds be suspended in the state and restricted to Friday mosques only, while at the same time, even at those Friday mosques, strict observance of all COVID-19 protocols should be adhered to.
Local government chairmen across the 17 councils have also been directed to replicate the measures taken by the state government in their areas for compliance at all levels.
A consultant public health physician and member of the Association of Public Health Physicians of Nigeria, Dr. Ugochukwu Eze, joins us via Skype this time from the Amuwodofi area of Lagos. Good evening, Dr. Eze. Thank you for your time this evening. I understand that we're having difficulty getting to hear Dr. Ugochukwu Eze. At this point, we'll take a look and see if we can get him back. But while we're waiting to see if that will happen, the American Federation of Teachers, that's now right outside our shores, has said its members could go out on strike as a last resort if they are forced to return to unsafe schools during the COVID-19 pandemic. The Executive Council of the 1.7 million member American Federation of Teachers approved a resolution giving its affiliates across the country authorization to stage strikes, even as President Trump and Education Secretary Betsy DeVos are pushing schools to fully reopen, even though school district leaders say they need massive federal funding to do so safely. This is coming as the U.S. recorded more than 148,000 COVID-19 related deaths and more than 4.2 million cases as of now. America's leading infectious diseases expert, Dr. Anthony Fauci, says it's crunch time for vaccine development. Our Washington correspondent, Maria Bird, has more.
Medical experts are calling for a second shutdown in the United States, as many are stating that the shortage of therapeutic drugs and medical supplies are forcing them to make choices about what patients receive treatment based on potential survival rates. President Trump responds to this with a news conference highlighting the vaccine progress.
Moderna vaccine has officially entered phase 3 already, and that's phase 3 clinical trials, the final stage before approval. There's never been anything like this in terms of speed, nothing even close. A second vaccine is likely to enter phase 3 in a matter of days. Under Operation Warp Speed, we've shaved years off of the time that it takes to develop a vaccine, in some cases many years, and we've done it while maintaining the FDA gold standard for safety.
The National Institute for Health and Moderna Drug Research heads into its final stages with over 3,000 participants.
Hopefully finding a vaccine for it is huge. Doing our part to eradicate it is very important to me.
We can move into the general public and actually mass producing and having this given to the population. This is enormous. We've been sitting on the sidelines passively, attempting to wear our masks and social distance and not go out when it's not necessary. This is the first step of becoming active against this.
Republican senators have introduced the second stimulus bill to Congress, and many Democrats are unhappy with the bill as it proposes a $400 reduction in unemployment benefits.
They're not really ready to have a serious negotiation. However, we'll continue, we'll read what they put forth.
This is a moment when everyone knows the private sector can't do it, and they have to overcome some of their resistance to letting the government do it, because it's only the government that can help us with the greatest health crisis.
Many Americans are out of work and depend upon the U.S. unemployment benefits and medical research to identify a vaccine so that the economy can fully reopen. From Washington, Maria Bird, Channel Television News.
Okay, let's see if we can talk to Maria now. She's joining us from Washington, D.C. Good evening, Maria. Thank you for your time. Trust you're keeping safe.
Good evening. Yes, we are trying to here in Washington.
Given the situation as it were, where we are now, what can you tell us is the update with this spike in cases, just as teachers are saying that they are considering striking as an option to prevent schools from reopening?
Yes. Well, the spike that's occurring, many are, even the president now, which we know that many have said they thought he should have had a stronger stance as it relates to social distancing, wearing masks. He's now asking people to do that because we can see that many of the younger people, and these are young adults, 25 to 35, where we've seen the greatest spike in COVID-19, are going out, not wearing masks. And many states have not required mask or social distancing guidelines. And so many people, they're tired. We're summertime here in the U.S. Summertime is a time when people look to go out and have a good time. And many people are tired of being, kind of confined. And so they're not following the appropriate protocol. And so we're seeing, heavy spikes. And doctors are asking for there to be a second federal government shutdown.
The other thing, of course, is that all this is happening at the same time that vaccines, or there is a vaccine in the final stage of trial, which ordinarily should be good news, right?
Yes, and I think for many Americans it is good news. Now the question is, once the vaccine is actually made it through the final trial, how much will people really trust the vaccine? That's the question that's kind of been looming now due to the fact that it's been so escalated in the process. And the FDA has approved this very quickly. I mean, this is the quickest we've seen in modern day history of a vaccine being walked through the process. And so the question is, what will, the public say, and will they feel comfortable, especially as you mentioned, teachers are saying they're going on strike. Will parents feel comfortable with giving their child a vaccine this early in the stages? And that will probably be a requirement for many school districts as they reopen.
Republicans in Congress are proposing a second a stimulus bill over COVID-19. Already the first one seemed to have caught so many people unawares. Are they proposing a second one possibly because they think the first might not have the kind of effect that it ought to?
The real reason for the second stimulus bill is we know that unemployment is continuing to increase in the U.S. And so many people are looking or needing those unemployment additional benefits. And it's about $600 extra that they are receiving as part of the first stimulus plan, which is helping obviously with the rents and the car notes and mortgages, just a myriad of things that many Americans, are when they're without a job, they don't have money to pay for. And so that's the number one reason. You also are looking at small business loans and small business funding that will allow them to be able to reopen or to keep their employees employed while potentially, they're not receiving the same sort of retail coming in their stores, people buying. And so this is really to keep the economy going is the real reason for the second stimulus plan.
Looming over all of this is the issue of the elections coming in November. How is that playing out in the middle of all these other stuff that is happening?
Well, the elections are a major big deal here in the U.S. I mean, just earlier today, the Attorney General Barr was brought before the House panel and relating to some of potentially the Russia investigation, and he was brought forth to, answer some real serious questions. They talked about, the tear gassing that happened in Lafayette Square when the president went up and held the Bible. And so they asked him some very poignant questions to know, are they putting federal troops into cities to combat violence, or is it really about the reelection? And as we know, President Trump, campaigned on law and order, and you're beginning to hear him say that even more and more as we get closer to the election time, where he's saying that, I'm the president of law and order. So it is clear that we are in a time where the election is of the utmost importance. But you're also seeing where the polls are not necessarily showing the same sort of support for President Trump as it did 4 years ago.
Indeed. Thank you very much, Maria. Thank you for that update and for your time. Do continue to stay safe out there. Our correspondent, Maria Bird, in Washington. More countries in Europe are reconsidering measures aimed at protecting tourists from Spain, with not just the UK, but now France and Germany warning against travel to parts of Spain. Meanwhile, authorities in Madrid have made wearing of face masks in public compulsory at all times as part of measures to prevent the spread of COVID-19 in the city. This comes as Spain reports a spike in cases in some regions during recent days.
Germany's foreign ministry is advising holidaymakers not to travel to several Spanish regions, including Catalonia, home to Barcelona, that have seen coronavirus infection rates rise. The Interior Ministry says it's in favor of implementing mandatory tests, but couldn't imagine Germany reintroducing border controls in Germany. Spain's rise in COVID-19 cases has prompted most regions to impose rules for masks to be worn everywhere, and in several areas, including Barcelona, calls for people to stay at home. Meanwhile, Austria's health minister is warning against complacency after 62 people were infected with coronavirus at a resort town. Rudolf Anschober told reporters in Vienna that risk awareness had dropped, but that the pandemic was far from over. Austria's health agency says the outbreak was traceable to a bar in the town of St. Wolfgang near the German border, and that mainly in turn were affected. Vietnamese authorities set up checkpoints and closed down shops to enforce a partial lockdown in Da Nang after a fresh outbreak was detected in the city. The city, a tourism hotspot, had reintroduced social distancing measures over the weekend after the government confirmed at least 14 new cases, the first reported domestically transmitted cases in more than 3 months.
The harsh reality, my friends, is that we are at war.
Kenya's President Uhuru Kenyatta has extended a nightly curfew for another 30 days to curb the spread of COVID-19.
Let us not think that we are immune or special. We're not. Please, fellow Kenyans, let us not follow the examples that we have seen across the world.
The curfew had been due to be lifted on August 6th or 7th.
You can take a closer look at some of the COVID-19 global numbers in real time by logging on to our website, channelstv.com. You will get more updates there. You can find the latest stories in Nigeria and across the world, including the details of the extended phase 2 of Nigeria's East lockdown from now for the next 1 week. That's the extension lasting until August the 5th. Thank you for watching. I'm Ladi Akiri Duluale. Good night.